The meeting of the state health sector in collaboration with nutrition partners in the state is to review, adapt, learn from, vet and endorse scopes of practice, job aids and health counseling, materials for healthcare workers from the nationally developed maternal, infant and young child nutrition guideline and strategy, National Guideline for Baby-Friendly Initiative, and National Micronutrient Deficiency and Control Guideline. The documents are to take cognizance not only of the state peculiarities, but will also address the challenges of maternal, infant and young child nutrition MIYCN in the state, and the documents will also automatically fit into the national framework. Executive Chairman, State Primary Healthcare Development Agency, Dr. Ruwanu Mohammed said the state needs to step up campaign for MIYCN, which is out to promote acceptable norms around exclusive breastfeeding among mothers, families and communities in order to address malnutrition among children and to also reduce pregnancy-related complications. Represented by the Director, Disease Control and Immunization, Ahiru Ibrahim Mahmood, the chairman stated that maternal nutrition from pre-conception, pregnancy, and through the first 6 months of a child's life is essential to tackle maternal and infant morbidity and mortality. Dr. Ruwanu Mohammed said the adaptation of the MIYCN document in the state will give unified policy direction in the implementation of maternal, infant and young child nutrition.
As you can see now, we are trying to develop documents around MIYCN, policies, guidelines and what have you. So this will go a very long way in terms of having policies around the implementation of activities around a certain program. Now, those that are not aware, they will now be aware that MIYCN is something that the communities have to be involved. All the stakeholders have to know, because the moment you disseminate a document that will go across all the stakeholders in the state, they will be aware of what to be done.
All the stakeholders said the state indices on exclusive breastfeeding and early initiation is very low, according to the Multiple Indicator Cluster Survey MIT 2021. They noted that more needs to be done to enlighten mothers and the communities on the importance of MIYCN.
My responsibility to follow up, to ensure or to coordinate all the nutrition activity in the state. Is part of my responsibility to ensure that each and every partner that is supporting Bauchi in the area of nutrition, to see that they implement their activities successfully. And also with the coming of Alive and Thrive, Alive and Thrive, they are supporting only MIYCN, especially in the area of social and behavioral change communication.
The advent of what has been happening, so many partners are now supporting nutrition aspect. So there are a lot of activities that have been done, and we are still doing other ones on nutrition for that of the mother, that of the children, that's under 5 children, newborn and under 5 children.
In terms of nutrition programs in the state, we have an advent of many organizations or donor agencies that is supporting the program as well.
Elizabeth Ka, BATV News.